1, 2, 2, 3. 1, 2, 3. In the place to be. In the place.
Mic check.
Good evening, everybody. It's great to see so many people here. David and I are going to speak about the assessment committee. I've been in 4 meetings. I'm not quite sure when or where the next meeting is. We're told about 3 days before it happens. At the last meeting, well, actually, David and I, after the first meeting, after we saw the slides that North Shore LIJ provided from a Sparks site, which anybody can get off the internet, we looked at each other and we said, these slides are showing we need a hospital on the Lower West Side. And as the meetings have gone on, it's continually showing we need a hospital on the Lower West Side. It's almost, you look at it and say, there's no question here about that. So we continue to go to the meetings. At the last meeting, they're working with Hunter College, North Shore LIJ is working with Hunter College to do a survey. The survey looks very quantitative and not qualitative. In other words, yes, no answers. They're not going to take any stories. So there was a big discussion about that, about changing some of the questions. It's going to be a monkey survey. I don't know if any of you know what a monkey survey is. Okay. It's a survey that, it's a website survey that grammar school kids could probably do. I don't know how else to describe it. We weren't sure where this was being funded by in the beginning, and we're still not sure where it's being funded. But I thought with Hunter College being used that it would have been more of a professional survey instead of a monkey survey. So that's all I'm going to really say about that. I sit on the assessment committee not representing the coalition. I'm there representing the New York State Nurses Association. So we've been pretty interested in that. The Litch situation, we're very happy to see Litch coming back because that is one of our union hospitals. But I think that the people on the Lower West Side, you don't close a hospital completely. I don't know how to explain this. I've listened to Mr. Stringer before, and he was talking about the Upper West Side. At least they have a decision to make up there. You don't have a decision down here. You don't have a hospital. You can't sponsor with somebody. You can't, the hospital's gone. They have hospitals up there. And I think he missed that point because we don't have a hospital up down here. We don't have any decisions to make anymore. There is no hospital. So you need to keep that in mind while people are speaking tonight. And thank you all for coming. It's nice to see all these faces, but they look very sad right now, and I'm sorry I can't make you feel better. So I'm going to turn it over to Dr. Kaufman.
Thanks for all coming tonight. I can't speak quite as easily, so I'm going to read most of what I have here, okay? I enjoyed Tom's presentation. It's a hard act to follow, but I'm going to do my best. As Eileen said, we've been asked to talk about what was originally called the needs assessment, but which at some point, which I can't actually figure out, the organizers renamed, for very mysterious reasons, the community health assessment. We all still refer to it as a needs assessment. I've been struggling with what to say tonight for days since Eileen and I were asked to go to these meetings. I found it very frustrating, so it's been hard to decide. But then this morning at around mile 2 on my treadmill, it really hit me. So here goes. What I want to do with you is throw out a lot of data points and a lot of facts. Some of them you've heard already, which makes it a little easier, and then see if there's a way to connect these dots. We'll start by reaching back to 2005, when some of you may remember the Commission on Healthcare Facilities in the 21st Century, clumsy name for what came to be called the Berger Commission. That was chaired by Stephen Berger, and its work was to close hospitals. That was its assignment from Governor Pataki, close hospitals in New York. I want to note, incidentally, that Mr. Berger knows absolutely nothing about healthcare, nothing about patient care, nothing about hospital systems or even health insurance. He is actually, and this is true, I'm not making this up, he is actually a former GE finance executive. Interesting coincidence. And the former executive director of the Port Authority, a great purveyor of healthcare, I guess. Anyhow, in 2007, Berger's committee finished their recommendations with recommending that the state close 4,200 hospital beds to save money. That was singly the only reason to do it, save money. For a variety of political reasons, only about 2,800 of those beds were closed, but that included 5 hospitals in New York City. Needless to say, and you'll hear me say this over and over, but needless to say, there was absolutely no planning by the Department of Health or the state or the commissioner on where to send or how to care for the thousands of patients that used those beds and went to those emergency rooms in those hospitals. And as has been pointed out earlier by Jim, it will not surprise you that the majority of those patients affected were either Medicaid-insured patients or the uninsured indigent patients. Okay, so there's the first 3 dots. Dot 1, 5 hospitals closed. Dot 2, no preparation for the consequences of closure. And dot 3, mostly indigent, poor, sick people impacted. Dot 4, we all know, on April 30th, 2009, nearly a year ago, St. Vincent nails plywood to the windows and chains the front doors and the ER doors and every other door. Through a combination of gross mismanagement, executive incompetence, questionable financial dealings, a totally bizarre and suspect bankruptcy plan, and I had to clean my language up for that one. Suspect bankruptcy plan in 2005 that was preceded by even more puzzling financial practices in 2004. St. Vincent's is bankrupt and forced to close. I will not once again, since I've said this so many times, I won't once again go over the role of the DOH in preventing a partnership with Sinai to save the hospital, or the fact that St. Vincent served huge numbers of Medicaid and uninsured patients, or that it was the major caregiver for thousands of patients with HIV/AIDS, or that it was the singular provider of health care to thousands of homeless people living in the streets and shelters. Nor will I reiterate the total and complete lack of planning by the state once again to care for these people, as well as for the residents of the Lower West Side, as the DOH allowed this hospital to close without a plan, in 24 days. Now, what I would rather point out is the complete lack of regulatory oversight by the various state offices that are charged with overseeing the financial activities and reporting by nonprofit institutions such as St. Vincent's. It is our belief, the coalition's belief, based on a very careful review of a lot of documents, that hundreds of millions of dollars in hospital revenues simply disappeared. We've called repeatedly for an investigation by the Attorney General's office. We have called for an investigation by the New York City District Attorney's office, and even by the feds. And you'll never guess what the answer was. Utter silence. Ironically, in today's New York Times, front page, as I'm thinking about this talk, New York Times front page, there's an article that describes our new governor, quote, seeks to expand the grip to fight financial fraud, end of quote. Well, we're sick of these words and we want some action, so Cuomo, I know where you can start your fight. Okay, back to the dots, I'll try to move quickly. Number 4, I just told you St. Vincent's closure, a hospital is a major safety net resource for both the poor from our community and from all the boroughs, as well as the hospital of choice for tens of thousands of our neighbors and all of you. Dot number 5, no preparation for closure except for a $9 million award, a joke I might add, a $9 million award for an urgent care center that has yet to be built. Has anyone seen this urgent care center? Do you even know where it is?
Some other funds.
Unbuilt. Well, those are the profit-making ones. I'm talking about this one.
They all say they're emergency rooms.
That's right. Okay, dot number 6. Could there be something rotten here? Something that smells funny, yet all the authorities astonishingly refuse to investigate. Anybody see any patterns here? Any connections between the dots? I do. I see poor people losing their only source of health care. I see hundreds of thousands of residents, us, losing their community hospital with no planning whatsoever to deal with the consequences and no concern for the dirty side of these events. Moving on, at the last needs assessment committee that Eileen was just describing, the following data were presented based on New York State statistics. I am not making this up. This is straight out of the New York State Sparks Registry. which is a legal requirement of all hospitals to send their data in. Since the closure of St. Vincent's, the percentage of patients from our community going to Beth Israel Emergency Room has increased more than fourfold. The percentage to Bellevue has doubled, and to NYU and St. Luke's Roosevelt, it has tripled. And as was pointed out in yesterday's New York Post, the timing is great on these articles. In yesterday's New York Post, we learned, surprise, surprise, that the average wait to be seen in our emergency rooms was what? Over 5 hours. Not to be treated, released, or diagnosed, to be seen, okay? That feat put New York State as number 46, tied with the great state of Mississippi for healthcare in this country. So the DOH, did you read the, I don't know who's read the article, but the DOH, Department of Health response to that article was almost as astounding as the article itself. And I'm really not kidding, this is a direct quote. DOH spokesperson, our concern is that patients receive accurate diagnoses and quality care. Our system is not designed to be like the 12 items or less line at the supermarket. You could not make this up, okay? That's what they said. No comment from them whatsoever, from these guardians of our health, about what happens to quality care when those patients are forced to wait for 5 hours. No comment about the impact of this huge volume increase on those emergency rooms and their ability, therefore, to accurately diagnose and treat in a safe and timely fashion. Keep in mind, these were just the averages. What do you think actually happens at Bellevue, BI, and NYU when they're doubling and tripling their volumes? Okay, we're nearing the end of the dots. Since the closure, the percentage of discharges, this is now hospital admissions as opposed to emergency room visits. Since the closure, the percentage of discharges from BI, Beth Israel, has increased threefold, and it has doubled at NYU. Interesting numbers. Do you think it's a coincidence that NYU has actually gotten permission from the DOH and the state to triple the size of its emergency room while there's no resources for St. Vincent's? Do you think it's puzzling that Beth Israel is actually planning a brand new hospital tower? Where do you think it's going to be? On the east side. With DOH approval? Does this smell funny to any of us? At the end of the needs assessment presentation, the senior executive from North Shore LIJ, who's been quite astounding in his thoroughness, this is not meant as a criticism of him, I think he's been excellent. That senior executive who collected and presented all this data with his staff said the following quote, and this is a quote, this is not me paraphrasing or making it up, quote, "This community needs a hospital. The only question is how many beds should it be, and we need to make sure there are no gaps left open where care is needed." Okay? This community needs a hospital. Maybe Scott Stringer's onto something. Maybe that's the plan. I don't know. But I think we need to hold their feet to the fire. So how do we get a hospital? We've been working, all of us here, on this, and all of you, on this campaign, this crusade for a year now. It's hard to believe. We've been told endlessly and repeatedly that there is no need for a hospital, no money for a hospital, and no possibility, like we're dreaming, it's a joke, of getting a new hospital. Well, now we have one of the leaders of that so-called needs assessment clearly stating we need a hospital. How interesting is that? And last week, New York Press again, amazing timing. Last week, as Tom mentioned, we discover, I'm still in awe of this, we discover that New York State has had a fund, and we don't even know how long they've had it, a piggy bank filled with $683 million set aside to help hospitals. Where was that money last year before they shut the hospital down? $683 million. And then I learned recently that there was nearly $200 million, quote, left over in the Lower Manhattan Development Corporation, which had been established after 9/11. You remember 9/11? Some of you remember 9/11? That was, maybe you even remember the role St. Vincent's played with 9/11 and the 2 World Trade Center catastrophes. So let's see now, we've added up to $900 million and we haven't even tried to do any fundraising. I wonder if there's more of those piggybacks somewhere. Actually, I'm sorry, wrong about the total, it's not 900 because the state, as Tom mentioned, is spending close to $60 million of that to bail out Long Island College Hospital, which just happens to be owned by Continuum Hospital, which was the former employer of Commissioner Dean's. Any patterns? All right, almost done. Too many dots for me and too hard to connect because they all keep overlapping. That North Shore exec said it very simply and very clearly. We believe the money is there. We just have to find it and make them use it. And you will hear that the hospital building is still there. I think you probably walk by it like I do every day. And that it can be reopened. And there are ways to raise money. Aside from the $900 million, people do this all the time. In every city in this country, they issue bonds and raise money for this kind of thing. The only thing missing, and this is going to be the theme over and over, the only thing missing here is the political will and determination. The only thing missing is a decision and an admission by Governor Cuomo, the Commissioner of Health, the new one at this point, that this huge and diverse community must have a hospital. And there's only one thing that's going to force that decision, and I think you all know it, but I'll say it. It's your voice, relentless letters, calls, and cries to our elected officials, and your refusal to accept anything less than a full-service hospital and emergency room. We may leave this room tonight, and by Monday find out that campus is sold. And that doesn't mean this fight's over, it just means you have to get angrier and more belligerent and more out there in their face. The choice here is clear. It's not about condos or hospital, it's about getting a hospital. Thanks.
Thank you, Dr. Kaufman. Moving along as quickly as possible, someone who I think needs a little introduction here, Yetta Kurland, who's been a fearless